You mentioned there's not health freedom in this country. We're here at the Health Freedom Expo.
Yeah.
How do we get to that point? What do we need to do or start doing?
Move to the Maldives and form a new society. It's not going to happen. The pharmaceutical money is so big.
Mm-hmm.
It is so big. We are never, ever, ever going to be able to fight that. So what do? We can't get our message of health freedom or of health through the front door in this country because the front door is guarded by Big Pharma. My colleague, Dr. Wallach, when he was working for doing research at Yerkes Primate Research Center for NASA in Atlanta, Georgia, he discovered and published the cause and the cure for cystic fibrosis. Published it. He discovered, again, selenium. When the pregnant mother is deficient in selenium, the gene that codes for cystic fibrosis turns on. When the mother is replete in selenium, the gene does not turn on. The gene expression does not turn on. They could make cystic fibrosis happen at will, and they made it happen in monkeys. Before Dr. Wallach came along, everybody thought cystic fibrosis was a humans only illness, but it's not. But my point is, after he published that and proved it, they fired him. They fired him. Why would they do that? Number one, if they find a cure to something, the research money dries up.
Mm-hmm.
And number two, there's no money in selenium. You cannot patent a naturally occurring substance. You can't go to Washington, D.C. and patent orange juice or oxygen or water or selenium. So they fired him. Medicine, the front door of medical information in this country is guarded by Big Pharma and MD-directed allopathic medicine. So what do? We cannot go through the front door. So we are going to go through the back door. And how are we going to do that? We're going to do it the same way that every major religion has done it. We're going to do it through a grassroots movement. So Dr. Wallach's company, Youngevity, which I've been working with exclusively for the last 2 years, exists for one reason and one reason only: to change the way that medicine is practiced in the United States by developing a giant grassroots network of people telling their friends and family and community members and church members, listen, man, I know a doctor that says you do not have to suffer from that. I know a doctor that says you do not have to suffer with type 2 diabetes, with asthma, with arthritis, with osteoporosis, with high blood pressure. Come to one of our meetings. Come to one of our web events. Come to one of our free lectures. They're all free. Get the information, apply the information, recover your health, and then spread the word. And that's what gets me out of bed in the morning. That's the only way we're going to do it in this country, in my opinion, is through a grassroots effort, because the money is too big from the other side. There's no way we can fight them. So we have to ignore them and go through the back door.